Right. So we're really diving deep into stroke outcomes this time. Always super important.
Yeah.
And we want to understand like how having other problems, how
Right.
does that affect things?
Yeah.
If you've had like a heart attack in the past or even DVT,
Mhm.
something like that,
Right.
does that make it harder to recover from a stroke?
Absolutely. And it's really fascinating how interconnected everything is. We often treat these events like they're totally separate things,
Yeah.
but in reality, it's way more
It's
complicated.
like that whole domino effect
Ye-
within the cardiovascular system.
Yeah.
So to really get into the nitty-gritty, we've got this awesome research paper fresh off the press from April 2024. It's called Baseline Characteristics and Outcome of Stroke Patients After Endovascular Therapy According to Previous Symptomatic Vascular Disease and Sex.
Wow, they weren't messing around with that title.
Right.
Straight to the point.
But it really gets at the heart of what we're talking about.
Yeah. Absolutely. And, one of the things that jumped out to me right away was just how common it is for stroke patients to have a history of other serious vascular events. They found that 2 out of every 5 patients in the study had experienced at least one other issue.
Whoa, 2 out of 5.
Yeah.
That's 40%.
It's huge.
I mean, I knew it wasn't unusual, but that number's way higher than I would have imagined.
Yeah, it's a really significant portion of the stroke patient population. And it just highlights how important it is to consider a person's entire vascular history.
Yeah.
The study actually went a step further and found a strong link between those prior events and a higher risk of complications after the stroke.
Okay, so not just any complications. Like, what are we talking about here?
Things like having another stroke while you're still in the hospital so soon after the first one, or even an increased risk of death before being discharged.
Wow.
Yeah.
That's serious
Yeah.
stuff. It's like if you know someone has a history of falls, you're going to be extra careful with them on an icy sidewalk. You know what I mean?
Right.
This research is saying we need that same level of awareness for stroke patients with prior vascular issues.
Exactly. And to make things even more interesting, they actually found some key differences between men and women.
Oh, gender differences.
Mm-hmm.
Always adding another layer, don't they?
Always.
So what's
Let's put it out there. Well, both men and women with prior vascular events were more likely to have the usual suspects: high blood pressure, high cholesterol.
Right, the classics.
But for women, atrial fibrillation was a far more significant risk factor in this group than for men.
And just for those who haven't brushed up on their cardiology terms lately, atrial fibrillation, that's an irregular heartbeat, right?
And it can be a major contributor to stroke, because if the heart isn't beating effectively, it can actually allow blood clots to form, which can then travel to the brain.
So for women with these past vascular issues, atrial fibrillation is a huge red flag. It's like knowing there's a pothole in the road. You'd want to be extra cautious driving over it.
Precisely. And on the flip side, when it came to outcomes, men and women also showed some differences. For instance, they looked at the likelihood of experiencing bleeding in the brain after treatment, which is a serious complication that doctors call SICH.
Okay, bleeding in the brain. That sounds pretty scary.
Yeah.
What did they find?
They found that men with a history of vascular problems were significantly more likely to experience this bleeding after their stroke treatment.
This SICH we were talking about.
Yeah, exactly. SICH
Okay.
than women were.
Wow, that's a big difference. Really drives home the point that stroke treatment can't be one size fits all.
Right.
Men and women might need totally different preventative strategies and even different treatment approaches to really have the best shot at a good outcome.
Absolutely. And this is where the study takes another interesting turn. It actually delves into the complexities of the stroke treatment itself,
Okay.
specifically endovascular therapy.
Okay, let's break that down a bit. For those of us who, don't work in a neurology ward every day, what exactly is endovascular therapy?
So it's actually a remarkable procedure. Imagine a stroke caused by a large blood clot that's blocking a crucial artery in the brain. Endovascular therapy allows doctors to go in and remove that clot directly. How do they do that? Using a catheter. They insert it through a blood vessel, usually in the groin.
So it's like sending a tiny plumber to clear out a blockage in a really, really important pipe.
That's a great way to put it. And it's been a total game changer for treating those severe strokes, the ones caused by these large vessel blockages.
Okay, so back to that complexity you mentioned. What did the research reveal about using this type of therapy in patients who've already had other vascular problems?
Right. So they found that those patients, the ones with prior vascular events, often required more complex endovascular therapy approaches. than those without that history.
So their cases were just more complicated from the get-go, and they needed more specialized care.
Exactly. And this really underscores the importance of having specialized stroke centers and doctors who are really experienced in treating these more intricate cases.
It's not just about having the right tools, but knowing how to use them in the most effective way possible
Exactly.
for each individual patient.
You got it. Now, shifting gears a bit, there's one more finding from this research I wanted to share, and it's a bit of a head-scratcher.
Oh, I love a good medical mystery.
Okay, so we all know that high LDL cholesterol,
Right.
the bad cholesterol,
Right.
is a major risk factor for vascular problems like stroke.
Yeah, everybody's always looking for ways to lower their LDL.
Exactly.
Right.
But here's the puzzling part. This study found that patients with more prior vascular problems actually had lower average LDL cholesterol levels
Wait,
than those with fewer or no previous events.
that seems completely backwards.
I know it's counterintuitive,
Yeah.
but there's a catch. Even though their LDL levels were lower, they were still above the recommended levels for people at such high risk for another event.
So they were doing better than other high-risk patients,
Yeah.
but still not nearly well enough.
You got it. And this raises a really crucial question. If you're already at high risk for stroke, is simply aiming for, quote unquote, good cholesterol numbers really enough? This study suggests it might not be.
That's a really important point, because if their LDL is still too high, that could be contributing to these worse outcomes we see, even with all the current treatment advances.
Exactly. And while this specific study doesn't offer like a definitive answer, it really highlights a critical area for future research.
For sure.
It also underscores the importance of looking beyond just the numbers on a cholesterol test.
What do you mean?
Well, someone could have decent cholesterol numbers, but still have a whole host of other risk factors at play, like family history or lifestyle choices that need to be addressed.
Right.
It's about seeing the complete picture, not just one piece of the puzzle.
Don't miss the forest for the trees, as they say.
Exactly.
Yeah.
Precisely. And that's where having a doctor who really takes the time to understand your individual risk is so important.
Absolutely. It's all about personalized care. So we've covered a lot of ground here. Any other big takeaways from this research that we should touch on before we wrap up?
Yeah. One more thing that really stood out to me was that the researchers themselves actually emphasized the need for more focused research on sex and gender-specific risks and treatments for stroke.
Okay.
We've made some progress in understanding these differences, but there's still a lot we just don't know.
It feels like every answer we find just leads to more fascinating questions, like why are men with prior vascular events more susceptible to bleeding in the brain after this particular stroke treatment? And why is atrial fibrillation such a big deal for women in this group specifically? So much more to explore.
It's a never-ending quest for knowledge.
Isn't it, though?
That's what makes it so interesting.
Well said. So as we come to the end of our deep dive today, any final thoughts you want to leave our listeners with? Something to ponder as they go about their day.
This study really honed in on what happens after someone's already experienced multiple vascular events, which is obviously critical for improving treatment and preventing, further complications.
Right.
But it got me thinking, what if we shifted more of our focus to actually preventing that very first event?
Oh, interesting.
Whether it's a heart attack, a stroke, or something else entirely. Imagine the kind of impact we could have on the overall burden of these conditions.
That's a powerful thought to end on.
Yeah.
It's easy to get caught up in managing diseases after they develop, but what if we put just as much energy, if not more, into preventing them in the first place?
Absolutely.
Definitely something to ponder.
Food for thought.
Well, on that note, we'll leave you to contemplate those possibilities. Thanks for joining us for the deep dive, where we take your research and extract those need-to-know insights. Until next time.